It's that time of year that many people dread signing up for health care benefits. The coverage options are costly and complicated.
Well, today you're in luck. We're going to walk you through the options and how to find the best fit for you. Julia Fellow tells us what's changed and what remains the same this year under the Affordable Care Act.
First things first, you will face a penalty if you do not sign up for health care for next year. It'll be $695 or 2.5% of your annual salary, whichever's higher. Caroline Gomez-Tom is trying to get the word out about open enrollment that started last Wednesday. The program manager of Milwaukee Enrollment Network says that many are still confused if it was going to happen.
Insurance is hard. It's really complex.
Especially for nearly 65% of people enrolled in Milwaukee County under the Molina plan. The provider is dropping out of Wisconsin next year.
Which here is about 18,000 people. And so they will be auto-enrolled into a different plan, but what isn't confirmed is if that plan will cover their doctors, cover their medicine.
Most people will qualify under some type of financial assistance.
In Milwaukee County specifically, there's 3 health insurance plans to choose from, and the financial assistance is still available.
Certified and trained people are ready to help you walk through the process in their office to help you choose the right plan. You can also call 211 to schedule an appointment with an enrollment assistant. We have more information at tmj4.com. Reporting, Julia Fellow, today's TMJ4.
All right, Julia, thanks. Deadline for open enrollment under the Affordable Care Act runs through December 15th, so there's still time.
So Kathy Mahaffey has been navigating through the health insurance maze for more than 25 years. She's the CEO of Common Ground Healthcare Cooperative. What's the #1 issue you see that people need to know about signing up for the Affordable Care Act?
I think this year the #1 issue is the amount of time. The open enrollment period is less in the amount of time this year, so there's only 6 weeks for people to enroll.
No procrastination.
No, act quickly. I'm telling everyone, make your selection before Thanksgiving, because then you can have a stress-free holiday and,
That's good
get
to
it all
know.
done.
Yeah.
But as we heard in that story, insurance is hard. I mean, it just seems to be complicated. What's the biggest mistake people make when trying to fill out for their benefits?
Right. So I think people, it is complicated, and it shouldn't be so complicated. But really examining the options, the benefits that are available, the provider network that's available, and so I think getting assistance is really the key. Navigators, enrollment assisters, insurance agents, helping them navigate their way through all of the choices and the options.
What do those options look like this year? A lot of confusion in Washington about the Affordable Care Act, and better known as Obamacare, as people call it. But so what's on the table right now, and is there uncertainty about those benefits?
Right. So we want people to know that everything is intact. The Affordable Care Act is still the law of the land. So the benefits, the essential health benefits, the comprehensive coverage is still there. The financial assistance to help people pay their premium is still there. And the benefit plans that are available to folks that have lower incomes are still available. So although there's been a lot of uncertainty this year, the Affordable Care Act remains intact. And we want people to know, just with confidence, go to healthcare.gov and look at the options available, because they're still there.
So basically, even though there may be uncertainty in Washington, it is certain that the law of the land is still the ACA, and you have those benefits that we've all known about for this year at least. So go ahead and apply. Do you find that many people just feel overwhelmed by it all?
Definitely. We see that every day with people. They're still not sure, even that there haven't been any changes. And so we just want to reassure people that, please take the time, go to healthcare.gov, look at the options, use the resources. There's great community resources here, and look at what's available to you. So we don't want people to not take action because they're just concerned because of all that's been going on this year.
Kathy, what do you know about the options? We hear about insurance companies that have dropped out, no longer can stay in. Do we have fewer options?
Yeah, there's no doubt there's fewer options this year. We've had 2 insurance carriers exit the marketplaces for 2018. So there's a fair amount of consumers this year that have to change their health plan.
Right, so if you were on them last year, you're not going to be able to use them this year.
Right, but is fewer options mean that there's less quality care available?
No, I think that the carriers that are still available, they're very committed to the marketplace. We have great provider partners, so there's great care available to members. There definitely are fewer options to choose from, but there's enough for folks to find to get the care that they need.
Can you give us a few tips? If you're single, okay, you don't have any dependents, what should you be looking for? How do you navigate through that?
Well, I think, you know, the difficulty here is that there's a lot of personal choice, right,
Sure.
in what people are looking for. Some consumers are really just looking for something that will cover them in the event anything might happen. And so they're going to be looking for the lowest cost option. They're not going to be so in tune to what it covers or what it doesn't cover in terms of what my deductible is or out of pocket. And then there's other consumers that might have a chronic condition. So they're more concerned about the benefits or the providers, very important to them, what provider systems are part of the program. So they're going to be looking at what is my out-of-pocket, how much would I have to pay if I incur services, and is my doctor in the network?
So what does that mean when you say low premiums, high deductibles?
Right, so
You're thinking like, oh yeah, I see that number, this is what I'm going to have to pay per month, but as a high deductible, you might be paying some more down the road, right?
absolutely. So both of those components are very important to look at. So you know, usually the lower the premium for the plan usually means that the deductible or the out-of-pocket is more to the consumer. So those are choices that the consumer has to make. If they're looking for something that's, you know, really just the lowest premium, I want to pay the lowest I can for my insurance, that may mean that the out-of-pocket is more.
But could that be like if you are, like you said, single, no children, pretty much very healthy, only go for your, you know, primary care events, that lower may be the best option for you?
Yeah, that may be the preference. But I think also this year what everyone should know is that particularly for consumers that are below 400% of the federal poverty level, the premiums are, you know, definitely more affordable than they have been in the past. So you still could get maybe a comprehensive plan.
Sure.
But you're paying very little out of pocket for the monthly premium.
Right.
So it's just really worth taking a look this year because things have changed. They're still there in terms of we can provide people with the certainty that the health plans are there, but in terms of what you pay, that might be different.
Thanks for walking us through that, Kathy. Appreciate it.
Well,